So what should you look for? Because I mean, you're looking for bang for your buck, and at Made to Thrive, we want to always optimize people's time and energy. There's only so
Mhm.
much finance. There's only so many things that they can do. This continuum of functional medicine and integrative
Sure.
medicine. There are so many modalities. What are people going to look for in terms of flow rate or the oxygen chamber if they're going to be doing mild hyperbaric oxygen therapy, or should they just go to a medical doctor and get into a hard chamber and rather spend the money at a 2 ATA and get 100% oxygen, which is a far safer option in many ways, but might be unaffordable for them?
I just think it depends on the indication, honestly, Steve. I mean, because if they have an indication that would really benefit from hard chamber hyperbaric therapy that goes to deeper pressures, then absolutely that's what they should do. If they have more of a, they have more of a, they're more concerned about optimal performance and they're doing things more like in the biohacking sort of way. I've really seen amazing things for people that have done the chambers in more of an integrative way. I've also seen really great benefits for patients with central nervous system related issues and spinal cord related issues. Although not talking about like paralysis or anything like that. I'm talking about maybe like things like MS, for example, but not, but I would say that what's nice about the mild chambers is that they're very, at least the ones that I work with. I can't speak for every hyperbaric chamber in the world because I simply don't know, but I am very clear about the ones that I work with and making sure that they're safe and that they've been tested in the ways that I feel that are appropriate. Now, in the US, there are several different brands that have FDA clearance, which means that they've gone through the FDA process and gotten a clearance. There's others that are used across the world that have their own designations that I'm aware of as well. And so I work with those companies mostly if I'm going to be using the mild chambers to make sure that you know what you're getting. The challenge is that there's so many chamber companies out there and you don't know what you're getting. And that is certainly a difficulty. And so one of the things that I've been trying to do over the last several years is bring more attention to all of this, but also bring some education to the soft chamber companies, because the challenge is that these guys unfortunately think that they can do that people can do anything in those chambers that you can do in a hard chamber, and that's just not true. One of the things that they will tell you is that, and I don't, there's no evidence to this, is that you can do more treatments in a mild chamber, and that'll be the equivalent to doing less treatments in a hard chamber. And that may be true for neurologic indications. That may be true for milder pressures when you're going to 1.3 to 1.5. But I certainly do not feel it's true at all if you're doing it more for a systemic indication. I don't put in patients that have had chronic infections most of the time, because chronic infections, especially Lyme disease, can get worse in a mild environment. If patients have obviously any of the insurance indications, so the insurance approved indications in the US, always in the hard chamber, except for the acute mountain sickness one. And so I'm always very, I think, emphatic in the sense that that people should be using the chamber that's most appropriate for them, and then also vetting the chambers that they're using and the people that are using them to understand the safety. Like nobody should be in a chamber with 100% oxygen if you have a mild chamber. You just shouldn't be doing that. They shouldn't be blowing oxygen in the chamber instead of using a mask or a nasal cannula. That's just not safe to do. Another thing that's happening a lot recently is that you're seeing hydrogen get thrown into some of these chambers as well. And I don't feel like that's a great idea either because hydrogen and oxygen are both flammable gases. And so there might be a role for hydrogen in patients that have significant pulmonary, potentially and especially pulmonary toxicity or oxidative stress in the lungs, but I don't think it should be done inside the chamber. There's one company that is actually using that they're taking out the nitrogen in the chambers and just putting in hydrogen and oxygen. I think that's a bad idea.
Okay,
And so,
gotcha.
I think that's why it's important to vet all this stuff out. And that's why I only work with companies that have vetted this out, and that it's important to know where your chamber is coming from and who's running it, and have a good feel for the whole process.
Brilliant.